Namaskaram everyone. Welcome to CLTV YouTube channel. Please like, share and subscribe.
In ADHD is loosely used as a term by many people. Hyperactivity component is not there in significant number. Hyperactivity is this is very important that people should recognize that mental illness is the biggest contributor for job losses and workforce తగ్గిపోతుంది.
Have you seen those kind of cases?
Very often day-to-day practice లోనే నేను చూస్తుండే అంటే certainly the impact on the personal relationships on the mind is immense. అన్నిట్లోకి టాప్ స్కోర్ 100%, 100 పాయింట్స్ ఇచ్చేటువంటి మ్యారిటల్ లాస్ ఆర్ రిలేషన్షిప్ బ్రేక్ డౌన్ ఆర్ bereavement of spouse is given as a score of 100.
Hello all, thank you so much for tuning into CLTV podcast. We really appreciate your support. చాలా తొందరగా 1000 మంది సబ్స్క్రైబర్స్ రీచ్ అయ్యాము. It's all because of your support. And please keep sharing the videos. Please keep liking the videos so that we can get more wonderful guests like Dr. Prayaga.
Dr. Ram Prayaga is a board-certified psychiatrist practicing in Brantford, Ontario since 2000. Graduating from Andhra University in India in 1975, he completed his residency in psychiatry at the University of Toronto. Affiliated with Norfolk General Hospital and Timmins and District Hospital, Dr. Prayaga provides psychiatric care to patients with various mental health conditions. Fluent in English, Hindi, Persian and Telugu, known for his calm and soft-spoken demeanor, attentive listening skills and thorough assessment and treatment of patients, Dr. Prayaga has experience in treating mood disorders, anxiety disorders, psychotic disorders, ADHD and PTSD. He also offers psychotherapy, medication management and electroconvulsive therapy as part of his services. Involved in humanitarian work, Dr. Prayaga travels to other countries to provide mental health care to those in need, passionate about improving the quality of life of his patients and the communities he serves.
Namaskaram Prayaga garu. Thank you so much for accepting my invite and coming over for a podcast of a CLTV. I really appreciate your presence. So do you mind telling us about a little bit about yourself, where you have started and what are you up to? Thank you.
నమస్కారం అండి. నాకు ఈ మాధ్యమం ద్వారా నాకు అవకాశం వచ్చినందుకు నాకు కూడా సంతోషంగానే ఉంది. నలుగురికి నాకు తెలిసిన 4 మాటలు చెప్పాలనే ఉంది. నేను సుమారుగా 25 ఏళ్ళై కెనడాలో ప్రాక్టీస్ చేస్తున్నాను. ఇంతకుముందు చాలా కంట్రీస్లో తిరిగాను, విచ్ ఇంక్లూడెడ్ ఇరాన్తో ప్రారంభమైంది. ఇరాన్ తర్వాత ఐర్లాండ్, ఆస్ట్రేలియా, నార్వే, తర్వాత ఇంగ్లాండ్, తర్వాత ఫైనల్గా ఐ ఎండెడ్ అప్ ఇన్ కెనడా. ఒంటారియోకి రాకముందు 3 ఏళ్ళు నోవాస్కోషియాలో ఉండేవాడిని. ఆ తర్వాత ఇక్కడ బ్రాండ్ఫోర్డ్ లో అప్పుడే 24 ఏళ్ళు పూర్తయింది. అప్పుడే సో సైకాట్రీ ప్రాక్టీస్ చేస్తున్నాను. నేను జనరల్ అడల్ట్ సైకాట్రీ చేస్తాను, బట్ కొన్ని చైల్డ్ సైకాట్రీ పేషెంట్స్ కూడా కొంతమంది చూడడం జరుగుతుంది. తర్వాత ఓల్డ్ ఏజ్ సైకాట్రీ, ఫోరెన్సిక్ సైకాట్రీ వీటిలో కూడా కొంత ప్రవేశం ఉంది. మెయిన్గా జనరల్ అడల్ట్ సైకాట్రీ అంటే మామూలుగా 18 to 65, 70 years of age పేషెంట్స్ అందరినీ కూడా చూస్తుంటాం. సో అన్ని రకాలైనటువంటి సైకాట్రిక్ ప్రాబ్లమ్స్ తోటి వస్తారు. అంటే ఎక్కువగా ఏంటంటే డిప్రెషన్, యాంగ్జైటీ కామన్గా వచ్చేటువంటి ఫ్రీక్వెంట్ ప్రాబ్లమ్స్. సబ్స్టెన్స్ అడిక్షన్స్, తర్వాత ఇంకొంచెం మోర్ సీరియస్ ప్రాబ్లమ్స్ లైక్ బైపోలార్ డిజార్డర్, స్కిజోఫ్రెనియా, ఇలాంటి పేషెంట్స్ని ఎన్కౌంటర్ క్వైట్ ఎ లాట్. And mostly pharmacotherapy, but to some extent psychotherapy as well. This is my practice.
Wonderful, sir. Before we get deeper into your thing, pharmacotherapy and enti, sir? Just for sake of audience.
Prescription of medication. So, దాన్ని ఫార్మకోథెరపీ అంటారు. సైకియాట్రిక్ మేనేజ్మెంట్లోని డిఫరెంట్ కాంపోనెంట్స్ ఉంటాయి. కొంత most of it is in my practice is pharmacotherapy, meaning prescribing the medications and advising the side effects, monitoring the progress with different treatments, including the pharmacotherapy. సైకోథెరపీ పార్ట్ ఏంటంటే సపోర్టివ్ సైకోథెరపీ చేస్తాం. తర్వాత ఎందుకంటే ఎక్కువగా టైం consuming treatments like, say, cognitive behavior therapy or individual psychotherapy, psychodynamic psychotherapy. These are the ones which I refer patients to the psychologists and other community psychiatric nurses who practice the psychotherapy sessions.
వండర్ఫుల్ థ్యాంక్ యూ. అండ్ ఐ హావ్ సీన్ మీరు ఈ కొన్ని ఇరాన్లో పనిచేసా అన్నారు, అంతకుముందు వేరే యూరోపియన్ నేషన్స్లో కూడా పనిచేశారు అన్నారు కదా. సో టేక్ అస్ త్రూ లిటిల్ బిట్ అబౌట్ యువర్ జర్నీ. సో వై డిడ్ యూ ఈవెన్ డిసైడ్ టు గెట్ ఇంటు సైకియాట్రీ?
సో మొట్టమొదటి ఏంటంటే హౌస్ అయిన 20 రోజులకే ఐ స్టార్టెడ్ మై ఫస్ట్ జాబ్ ఇన్ ఇరాన్. ఐ వాజ్ మోస్ట్లీ practicing as a general duty medical officer, which included family practice, like something like a primary health center practice, where I encountered quite a lot of psychiatric practice. Usually family practice lo entante ikkada kuda significant amount of significant percentage of the family practice is related to psychiatry.
ఒక చిన్న క్వశ్చన్. సో ఫ్యామ్ ప్రాక్టీస్ అంటే ఏంటి? జస్ట్ సార్ట్ ఆఫ్ అగైన్
ఫ్యామ్ ప్రాక్టీస్ అంటే you first go for any patient with any problem, whether it is physical or mental, whatever. First person to talk to will be this
family doctor.
Okay,
got it. So family practice. Okay.
The primary health center practice also was mostly like that.
Got
so
it.
That's how I ended up seeing so many patients. Of course, not only the mental health problems, but substance use problems. When you encounter outrappudu, I got sort of attracted towards the psychiatry. If at all specialization cheste, I need to go into psychiatry and anukunnam. Incidentally, it so happened that the opportunities were quite good in psychiatric field when I explored Europe. So that's how I got sort of pulled into this branch of society.
Wonderful. So, all right. So, నాకు ఒక క్వశ్చన్ సార్. ఇప్పుడు ఐ గెట్ ఇన్ టు ది మై క్వశ్చన్స్ విచ్ ఐ హావ్ ప్రిపేర్డ్ ఫర్ యూ. సో బేసిక్లీ ఇప్పుడు మెంటల్ హెల్త్ ఇష్యూస్ అని అంటారు కదా. సో ఈ మెంటల్ హెల్త్ ఇష్యూస్కి రూట్ కాజ్ అనేది ఏమైనా ఉంటుందా? లైక్ ఈజ్ ఇట్ ది సర్కమ్స్టాన్షియల్, అంటే చుట్టుపక్కల ఉన్న సోషల్ సిచ్యువేషన్స్ ప్రకారంగా ఇష్యూస్ ఎవాల్వ్ అవుతాయా, లేదంటే ఫిజికల్ డిఫార్మిటీస్తోనే ఎవాల్వ్ అవుతాయా? అండ్ హ్యావింగ్ సెడ్ దాట్, ఇప్పుడు కరెంట్ ఫర్ ఎగ్జాంపుల్ ఇప్పుడు జాబ్ లాసెస్ కానీ కరెంట్ మార్కెట్ చాలా స్ట్రెస్ఫుల్గా ఉంది మన కెనడాలో రైట్ నౌ. సో ఇలాంటి సిచ్యువేషన్స్లో ఏమైనా మెంటల్ ఇష్యూస్కి దారి తీస్తాయా? ఐ మీన్ టు సే, ఇలాంటి సిచ్యువేషన్స్ మెంటల్ ఇష్యూస్కి దారి తీస్తాయా? సో ఇట్స్ అ వెరీ వెరీ బిగ్ క్వశ్చన్ ఐ గెస్. సో యా, ప్లీజ్ టేక్ ఇట్ ద వే యూ వాంట్.
క్వశ్చన్లో చాలా కాంపోనెంట్స్ ఉన్నాయి. ఫస్ట్ ఆఫ్ ఆల్, psychiatric disorders, ఒక సింగిల్ classification of that, but there are quite a lot of varieties of psychiatric problems. Broadగా వీటిని క్లాసిఫై చేయాలి అనుకుంటే anxiety disorders, mood disorders, organic mental illness, organic disorders. I'll explain about each of them. Then the psychotic disorders. తర్వాత లాస్ట్ సబ్స్టెన్స్ ఇండ్యూస్డ్ సైకియాట్రిక్ డిజార్డర్స్ ఇలా క్లాసిఫై చేసుకుంటే యాంగ్జైటీ డిజార్డర్స్ అంటే దోస్ ఇన్క్లూడ్ జనరలైజ్డ్ యాంగ్జైటీ, స్పెసిఫిక్ ఫోబియాస్, specific situation related anxiety, panic disorders, తర్వాత obsessive compulsive disorders. These are all coming under the classification of anxiety disorder. We go further, mood disorders, something to do with your state of mood, feeling tone. Whether it is on the low side or on the high side, both extremes of mood changes. And unipolar depression కావచ్చు, bipolar depression కావచ్చు, లేకపోతే ఇంకా related problems like psychothymia, etc., quite a few of them are there. Now, the next stage in this psychotic disorders like schizophrenia, schizoaffective disorders, where there is more serious pathology of your thought pattern, your perceptions, like having some hallucinated experience or delusional experiences. Those are classified into psychotic disorders. Organic mood disorders, organic mental illnesses include those which are caused by some injury to the brain in some form, whether it is head injury or vascular damage or any other neurological damage that is leading to the psychiatric symptoms. So, epilepsy కానీ లేకపోతే stroke కానీ లేకపోతే Alzheimer's కానీ ఇవన్నీ కూడా these are all classified under organic mental illnesses. And finally, substance-induced excessive use of alcohol or any form of street drugs can cause a lot of psychiatric symptoms, which include almost all the symptoms like psychotic symptoms or mood symptoms or anxiety symptoms, insomnia. Anything can be caused by the substance use. So these are the gross classifications of the mental illnesses. The main proven etiological factor, the causative factor of mental illness is genetics come first. Genetics, అందుకనే మేము ఏంటంటే ముందు ఫస్ట్ ఆఫ్ ఆల్ పేరెంట్స్ తాలూకా సిబ్లింగ్స్ తాలూకా మెంటల్ హిస్టరీ తీసుకుంటే తెలుస్తున్నాడు ఎంతవరకు ఈ పర్టికులర్ ఇల్నెస్కి ఆ సంబంధం ఉంది. జెనెటిక్స్, తర్వాత సబ్స్టెన్స్ యూజ్, స్ట్రెసెస్ అరౌండ్ అంటే whether it is in the form of relationship stress or financial stress or any other life event stress, anything can come under the social causes. So we're talking about the genetic causes, the social causes, and substance-induced causes, and finally any damage. Again, I talked about that, like any neurological damage. So these could be a few of the causative factors of the mental illness. Any form of illness can be caused by any form of stress. It is not particularly related to one etiological. That's why we take it as a psychosocial model. The causes of the psychiatric disorders are caused from not only the genetic and social, but also the other forms of stresses in life.
Oh my God! It's like it's like it's anything can cause the issue. అనే భయం కూడా వేస్తుంది ఒక విధంగా ఆలోచిస్తే. But having said that, like, what is the ratio of a disturbed marriage? For example, మీ ఎక్స్పీరియన్స్ లో బ్రోకెన్ మ్యారేజెస్ ఇంపాక్ట్ ఏదన్నా చూసారా, లైక్ ఆన్ యువర్ పేషెంట్స్? where you have father and mother going through certain disturbance, or there is a separation, or there is a death in the father or mother. So will that impact on the child? Like, out of your experience, have you seen those kind of cases?
వెరీ ఆఫ్టెన్ డే టు డే ప్రాక్టీస్లోనే నేను చూస్తుండే అంటే certainly the impact on the personal relationships on the mind is immense. There is what is called Holmes Rocky scale of stress. అంటే 10 పాయింట్స్ నుంచి 100 పాయింట్స్ వరకు డిఫరెంట్ స్ట్రెస్సెస్కి ఇంత స్కోర్ అని ఇచ్చారు. అన్నిట్లోకి టాప్ స్కోర్ 100 పాయింట్స్ ఇచ్చేటువంటి స్కోర్ అంటే మ్యారిటల్ లాస్ ఆర్ రిలేషన్షిప్ బ్రేక్ డౌన్ ఆర్ bereavement of spouse is given as a score of 100, whereas they're moving from home to home, even in a relocation from into one rental house to another rental house, or even relocation has 10 points. So between these scale, the Holmes Rise scale, you can imagine 100 points are given to the stress caused by the either bereavement or marital loss. Incidentally, they have observed men tend to get more depressed with the loss of wife, while women get more affected by divorce.
Wow.
So there is a strange observation there. Even though the stress can be equal, like losing a husband or wife, it could be equally painful for the other partner, but women tend to get adjusted more easily after the loss of the husband, while men tend to end up being depressed. ఇప్పుడు ఈ స్ట్రెస్ వల్ల ఏంటంటే not only the psychological problems like depression, anxiety, etc., even substance addiction can sort of marital loss can lead to all those problems. But immunity levels కూడా తగ్గుతాయి.
Oh my God.
Your immune systems go down, and you tend to develop a lot of physical problems like diabetes, high blood pressure, frequent infections, ఇలాంటివి కూడా వచ్చే అవకాశం ఎక్కువ. So the human body reacts to the psychiatric stress.
Oh, that's surprising to me.
Yeah.
So basically, it's like a polluted mind can corrupt your body. Not polluted in the sense, not something which is induced by self, but by environment around you. మనం ఒక స్ట్రెస్ఫుల్ ఎన్విరాన్మెంట్లో ఉంటే, స్పెసిఫిక్లీ మన అనుకునే ఒక ఫ్యామిలీలో, ఆర్ ఇట్ కుడ్ బి లైక్ యాజ్ యూ సెడ్ వేరియస్ avoidable reasons.
Yeah.
Wow, it's a surprise to me.
Then they say that this is very important, that people should recognize that mental illness is the biggest contributor for the job losses and workforce తగ్గిపోతుంది. And I got some statistics. Actually, you will be surprised to see that 15% of all the working people have some or other psychiatric problem. 15%.
Wow.
1 in 6. Now, coming to the next point, they have estimated globally the working days that are lost each year is 15 billion days.
Including all the nations and all the population.
The world.
Oh my God.
15 billion days of loss of work due to mental problems. And the loss of work is not just because of not only because of the psychiatric symptoms, but అంటే దానివల్ల absent అయిపోవడం ఒకటి. Absenteeism is one cause.
Okay.
But absenteeism also is with the mental problems leading to the loss of efficiency.
Yeah. Wow.
So presenteeism also is a dangerous thing. So in both ways there is loss of the workforce.
Wow. So, can I say it this way? Put reverse engineering chest there. So, can if at all I have to be healthy, I have to be in a family which is of less friction, which is of which doesn't create much stress around you. సో అలాంటి ఎన్విరాన్మెంట్ మనం క్రియేట్ చేసుకుంటే మనము బాగుంటాము, మన పార్ట్నర్స్ బాగుంటారు, అట్ ది సేమ్ టైం పిల్లలు కూడా బాగుంటారు ఓవరాల్గా. ఇస్ దట్ రైట్? Do you mind focusing a little bit on more on that?
కూడా ఇంప్రూవ్ అవుతుంది. Not simple. Psychiatric causes are the leading causes of one of the top leading causes of loss of workforce. అంచేత ఏంటంటే if you have identified a problem, you better talk about it quickly and get help at the appropriate time, so that your efficiency to work will improve, and thereby you get benefited and your employer also gets benefited.
That's about the employee. So how about the family part in it?
Family part, this is exactly where we are losing out. I mean, I previously was thinking that mental illnesses are more seen in this part of the world as opposed to
the eastern side of the world. Yeah, I know what you mean. Yeah,
but it so happened that family structure, family support systems are weakening all over. More so here, more nuclear families, more isolated lifestyle, less family support and the support of the friends will lead to obviously more quicker decompensation and more serious impact. అది ఇండియాలో కూడా కొంచెం తగ్గుతుంది. అంటే ఒక జనరేషన్ 2-3 జనరేషన్ ముందర చూసినటువంటి ఇది లేదు ఇప్పుడు. ఆల్రెడీ కొంతవరకు ఎఫెక్ట్ వచ్చేస్తుంది వెస్టర్న్ కాన్సెప్ట్ బాగా ఇండియా.
Because I mean, if you look at it that way, there is some utility attached to it. However, they are ignoring the major thing which will bring down whatever they earn. So as you said, ఇప్పుడు ఒక సపోర్ట్ సిస్టమ్ లో లేని పర్సన్ కి మేబీ దే కెన్ బికమ్ రిచర్, దే గెట్ అబండెన్స్, బట్ మెటీరియలిస్టిక్ అబండెన్స్ ఉంటుంది. బట్ ఎట్ ది సేమ్ టైమ్ వెన్ సంథింగ్ గోస్ రాంగ్ దే విల్ నాట్ హ్యావ్ ఎ షోల్డర్ టు రెస్ట్ అపాన్. సో దట్స్ I guess the world is going that way. But I hope that's kind of message which I'm not message, rather I'm not known to give a message. That's kind of input I wanted to get from you regarding this. So what are the ways that we identify that we are running into trouble within the family or within the work, within the office, like in the job structure or a business? And how do you rectify it and how do you come out of it to make sure that, our productivity is well, our mental health and physical health is also well? Very briefly, sir.
First of all, having that emotional support and having close family ties is one of the protective factors, I must say, with all of us. To have a healthy life, ఆ పర్టికులర్ ఏరియా జాగ్రత్తగా చూసుకోవడం, రిలేషన్షిప్స్ జాగ్రత్తగా చూసుకోవడం ఇంపార్టెంట్. Healthy lifestyle which would include proper disciplines in your activity level, the structure for the day, an exercise program. Physical exercise prevents mental illness. This, this is one of the frequent things we talk about in our practices. Do physical exercise. It not only improves your physical body, but also the mental function. The practices like meditation, yoga, these are all some of the protective factors we sort of see. Avoidance of excessive use of any alcohol, moderate, once you are crossing the moderation, obviously this will be impacting your brain in a negative way and lead to many psychiatric problems. Drug use.
Yeah, that's a given.
So
That's
these are the little things which we need to be. So common sense things, they are not really.
ఇప్పుడు ఒక చిన్న వెరైటీ క్వశ్చన్ అడుగుతాను మిమ్మల్ని. కాఫీ ఎలా ఇంపాక్ట్ చేస్తుంది మన మెంటల్ వెల్ బీయింగ్ ని?
కాఫీ ఇంట్రెస్టింగ్ ఫైండింగ్స్ అంటే నేను వినేటువంటి రీసెర్చ్ ఏంటంటే దే హ్యావ్ యాక్చువల్లీ స్టడీ మోడరేట్ కాఫీ డ్రింకింగ్ ఈజ్ అసోసియేటెడ్ విత్ లెస్ ఆఫ్ ది కాగ్నిటివ్ ప్రాబ్లమ్స్, మీనింగ్ the incidence of Alzheimer's and related cognitive difficulties are less in moderate coffee drinkers as opposed to non-coffee drinkers. So coffee has some
బెనిఫిట్స్.
effects, but anything more than 2 cups of coffee, especially those of Tim Hortons, you are likely to have hyperstimulation.
Yes. So basically, coffee does give an hyperstimulation for sure because I'm a coffee lover myself.
Many of us, we all have the ADHD symptoms. Many of the high achievers, professionals, they have some component of ADHD. దానికి మనం ఫస్ట్ మార్నింగ్ కాఫీ పట్టుకొని ఈ స్టిమ్యులేట్ ఎఫెక్ట్ వల్ల ఫోకస్ పెరుగుతుంది.
అది నా క్వశ్చన్ యాక్చువల్లీ. నేను నెక్స్ట్ క్వశ్చన్ అదే అడదాం అనుకున్నా. సో ఇది ఏడిహెచ్డి అని బాగా అంటారు సార్. సో ఏడిహెచ్డి అంటే అసలు జస్ట్ పదం వింటాం తప్ప నాకు అసలు జీరో నాలెడ్జ్ అబౌట్ ఇట్. సో if someone who is listening to our conversation, maybe they can comment and they can tell what more than that. So basically ADHD అంటే ఏంటి, and why is that very commonly seen and people are said, okay, you might have ADHD and you might have a small spectrum of this was another question. I was told that autism ane edaithe undo, it's a spectrum. It is not a one point thing. It starts at 0 and goes up to certain level. So I never know that. So how do you know that? Let's say, how do I know if I have ADHD? How do I know if I'm going have a small spectrum of my scale is in between the autism, yes or no? And is that dangerous or not dangerous? Is that impacting me in any way? And how do I ensure it supports me?
The question your question is now having 2 components actually.
Yes, exactly. I'm asking it. Minna dorkada kashtam kabatti.
Is the ADHD.
Yeah.
Again, ADHD is loosely used as a term by many people.
Mm-hmm.
The hyperactivity component is not there in significant number of people. Hyperactivity is seen only 10 to 20% of the people who have the ADHD. So it is called ADD, attention deficit disorder.
Mm-hmm.
It is more common where your mind cannot focus on one target. It keeps on wavering into different areas of thinking, of brain activity.
Sure.
So you tend to receive impulses from different angles and different sides. Your mind keeps on going into all the areas rather than staying focused on one. It is not necessarily a disorder. So many people have these tendencies, but they all can develop a kind of discipline to be able to stay on a target and be able to complete the project, whatever you are doing. Whether you're a student or working person, still you will be able to do the target. People who have significant derangement in this area not be able to do anything. I mean, they keep on distracted very easily. In children, it actually starts almost at the age of 4 years of age. It gets identified around the age of 5, 6. Parents, children ఏంటంటే హైపర్ యాక్టివిటీగా ఉంటుంది. So because of their distractibility, they keep on doing some things to get the attention of the parents. So they keep on, and they get told, don't do that, don't do that. That is wrong, actually. Instead of telling them not to do it, if you can divert their attention, do this.
You channelize their energy then.
Yeah. Then you can help them to get their attention to a thing that they may possibly like. So thereby, కొంతవరకు డెవలప్ చేయొచ్చు. బట్ యూజువల్గా దీన్ని ఈ కండిషన్ ట్రీట్ చేయడానికి ఏంటంటే కొంచెం కాంట్రవర్షియల్గా అనిపిస్తుంది. ఎందుకంటే స్టిమ్యులెంట్స్ ఎందుకు వాడతారు? అసలే హీఈస్ గెటింగ్ సో మచ్ ఆఫ్ distraction because of the various stimuli that he is receiving. Why would he use a stimulant? If stimulant helps to focus.
It's other way. Okay. For you mean for the hyperactive, the persons who are literally suffering to the max degree of ADHD?
Without hyperactivity, the attention deficit itself improved by using stimulant medication. Now we're going to the autistic spectrum. The autism, basically, by definition, it means lack of proper social development. They don't pick up the cues of the social gestures. Normally, ఏంటంటే మనం సైకలాజికల్ డెవలప్మెంట్ చిన్నప్పటి నుంచి స్టార్ట్ అవుతున్నప్పుడు కొంచెం 1-2 ఏళ్ళకే అప్పుడే చిన్న స్మైలింగ్, లేకపోతే ఫెమిలియర్ ఫేసెస్ కనిపిస్తాయి, ఏడు బాపేయడం, ఇక్కడ నుంచి స్టార్ట్ అవుతుంది. అంటే యువర్ సోషల్ డెవలప్మెంట్ స్టార్ట్స్ యాజ్ ఎర్లీ యాజ్ 1 year. As early as 6 months, not 1 year. So అప్పటి నుంచి అలా పెరుగుతున్న కొద్దీ నార్మల్గా అవతల వాళ్ళు వెర్బల్ క్యూస్ ఎలా ఫార్మ్ అవుతారు, సోషల్ క్యూస్ కూడా, వాడి బిహేవియర్ క్యూస్ కూడా అలాగే రెస్పాండ్ అవ్వడం వాళ్ళ పిల్లలకి అర్థం అవుతుంది, అలవాటు అవుతుంది. ఎప్పుడైతే అది ప్రాపర్గా ఉండదో, ఆ పర్టికులర్ డెవలప్మెంట్ ఎప్పుడైతే ప్రాపర్గా ఉండదో, వాళ్ళ సోషల్ జస్టిస్ మారిపోతాయి. It may or may not be associated with intellectual
capability of the person.
అంటే లెర్నింగ్ డిసబిలిటీ ఉండొచ్చు, కొంతమందికి అది లేకుండా కూడా ఉండొచ్చు. కొంతమందికి ఏంటంటే కొన్ని పర్టికులర్ ఏరియాస్లో చాలా ఎక్కువ స్కిల్స్ డెవలప్ అవ్వచ్చు. అంటే ఈవెన్ ఆర్టిస్టిక్స్ కూడా కొన్ని ఏరియాస్ ఆఫ్ బ్రెయిన్ ఫంక్షనింగ్ చాలా అద్భుతంగా ఉంటుంది. నేను ఒక యాక్చువల్గా వీడియో క్లిప్ చూస్తాను, మీరు చూసారు లేదా? రోమ్లోని హెలికాప్టర్ మీద ఒకరిని తీసుకెళ్తారు అన్నమాట. వాడు జస్ట్ అలా ప్యాసింగ్ గా చూసాడు అన్నమాట, ఏరియా వ్యూ అన్నమాట. బొమ్మలు వేస్తారు, అన్ని విండోస్ కూడా కరెక్ట్ నెంబర్ వచ్చేస్తాయి.
Correct. I've seen that. That was surprising.
ఒక ఆర్టిస్టిక్ చేశారు. అంటే some people will have special areas of skill that is there. So some people will be blessed with special gifted skills.
Wow. So if let's say if someone is suffering from this, they should, or someone is into this, they should not feel that okay, my kid or my brother or whoever it is like are going through this. This is bad, and no, there is a thing. There could be something special about them which they need to work a little bit and understand it, and try to bring that out.
You mentioned earlier about the wide spectrum. It's what this the autism. We cannot once again take every autism is the same.
Uh-huh.
One extreme form of autism who have got lots of behavioral problems, difficult to contain, physical aggression ఇలాంటివన్నీ ఉండేటువంటి ఆటిజం ఒక ఎక్స్ట్రీమ్ అయితే రెండోది ఏంటంటే మామూలు డే టు డే ఫంక్షనింగ్ నీలాగే నాలాగే డూయింగ్ దేర్ జాబ్స్ అండ్ functioning as a normal member of the society, but they have some traits of the autism that would affect their day-to-day personal relationships and their efficiency in job also. So, just there are some scales which identify those traits. Not that it's going to make much of a difference as far as the psychiatric conditions or psychiatric management is concerned, but it gives an overview of the prognosis. వీళ్ళకి ఇలాంటి డిఫికల్టీ ఉన్న వాళ్ళకి కొంచెం ఎక్కువ అటెన్షన్ అవసరం ఉంటుంది. వాళ్ళకి వాళ్ళ ప్రాబ్లమ్ని వాళ్ళు ఐడెంటిఫై చేసుకుంటే దానికి తగ్గట్టుగా
they can act properly. You're right. Like let's say, అంటే ఇది మరీ జనరలైజ్ చేస్తున్నానేమో, బట్ లెట్స్ సే if someone is good at math and someone that same person most of the times will not be good at art. Most of the times, if someone is really good at art, most of the times they are not good at math, because art is more of expression, math is more of intelligence and calculation and all. So ఈ రెండు కోఇన్సిడెన్స్ అయ్యే క్యాండిడేట్స్ చాలా తక్కువ మంది ఉంటారు. I mean, as far as I have observed, I might be wrong. సో ఈ కేటగరైజేషన్ చూసుకుంటే మీరు చెప్పిన దాని ప్రకారం ఇప్పుడు ఫర్ ఎగ్జాంపుల్ నేను ఆర్టిస్టిక్ అనుకోండి, ఏదో స్పెక్ట్రమ్లో ఎక్కడో ఉన్నాను. ఇఫ్ ఐ నో వేర్ ఐ బిలాంగ్, I might be able to choose the right job for me. I might be able to choose the right partner for me. I might be able to choose right community for me, right? So I think that awareness is much needed. Instead of getting depressed, instead of getting bullied by others, which basically donkey is trying to climb a tree for no reason. It's not a monkey, right?
Quite often, actually, we get asked by patients, please check me for the autistic trait.
They do? Oh, that's nice.
In my practice, especially, and I don't know whether it is the impact of the psychoeducation or social media, such requests are coming more in the last 5-10 years. Before that, people were not really to ask those questions.
That I'm really glad to listen to that, because people have become aware of these things. That matters a lot, because that eventually creates a better society, more productive individuals, and a nice environment to be around.
Yeah.
Fantastic. Having said that, sir, so I've got two questions in the part of the questions which, explanations which you were given. ఒకటి ఏంటంటే autism basic seed ఎక్కడ పడుతుంది అంటే, irrespective of the hereditary thing what you were mentioning earlier, or physical deformities, I'm talking about the social impact part. So recently we had a huge number of COVID babies on the planet Earth, and there is I might be wrong, but there is a observed phenomena about them that they are not much social in the current context. So do you see these people might develop these traits as the kids grow? And how do you ensure that they don't get deeper into it? If they have it, that's fine. How do you ensure that they don't get deeper into it?
So COVID is an interesting problem that is still yet to be understood. In fact, the physical impacts we have come to know a lot of them, but as far as the psychiatric effects of the COVID babies, we don't.
Studies in earlier.
It's too early to actually
Is it?
the statistical proof of incidence of conditions like autism or any other major defects that are come in future.
Mm.
But maybe it takes another 10-15 years of observation to come to a conclusive understanding of the impact, mental impact on the COVID babies.
10-15 years is pretty huge for the okay. Basically, 18 to 17 years, kids will be around that age.
I mean, that's the age actually, that kids like
Express.
and the impact on the stress కూడా ఎక్కువ అవుతుంది ఆ టైంలో.
Mhm.
రోల్ చేంజ్ అవుతుంది కదా ఫ్రమ్ అడolescence టు అడల్ట్హుడ్. ఆ
Ah.
రోల్ చేంజ్ అప్పుడు ఏంటంటే దే ఆర్ ఎక్స్పోజ్ టు లాట్ ఆఫ్ స్ట్రెస్, సెక్షువల్ అవేర్నెస్, తర్వాత adolescence crisis, what happens with their responsibilities at high school graduation, or what next time. The
Mm.
competitiveness in school, wanting to prove oneself.
Correct.
So that stress, to some extent, that is helpful. It takes you, if the graph is like this, it goes up, and suddenly it falls. And when
Oh,
to extreme, then the performance,
drops.
perform better అవుతుంది, other performance gets down. So the impact of the age and also the competitiveness in school will have negative effect after level.
That's scary because there is no visibility when the kids are growing, right? Kid might be active right now, but eventually, because I have a 9-year-old kid, and okay, that's scary in a way. But I have a question regarding this. Like, how do you avoid, or like not avoid? How do you ensure that kid doesn't get towards that way of these kind of issues? What you just suggested. Family ఏం చేయాలి అనేది, but we'll tackle it at the end of the come, because that's something which I really want to ponder upon.
ఇక్కడ ఇంకా న్యాయంగా కొంచెం కొంతలో కొంత మన అవేర్నెస్ ఉంటుంది. ఇక్కడ స్కూల్స్ లో మరీ అంత ప్రెషర్ ఇండియాలో మరీ అన్యాయంగా రుద్దేస్తున్నారు కదా వాళ్ళు. జస్ట్
ఇండియాలో కదా ఆ క్వశ్చన్ ఉంది, అది దట్స్ వేర్ ఐ గోట్ టు టేక్. ఇక్కడ కూడా ఉంది సార్ అదే ప్రాబ్లం.
takes people to even go to the extent of suicide.
Oh yeah, I understand what you mean.
That is one extreme. But what is important is not to push the children towards a particular goal as a doctor, engineer, just try to identify their interests and direct them towards the interest that they have in, rather than everybody going into a particular profession to prove oneself in this society. And identifying the skills in the child and go
And then building on it. It's a lesson for me also.
That would ease the child more in pursuing their career.
Wonderful. All right. So that's my other question. So Indian diaspora, specifically South Indian diaspora, who are in Canada, have not. We eventually end up, see, the generation of my generation, people who have freshly come in, or maybe a decade ago, probably they have went through a lot in India, right? చాలా మేము ఐఐటి లేదంటే మంచి ఇంజనీరింగ్ కాలేజ్ లేదంటే లాంగ్ టర్మ్ కోచింగ్ లేదంటే ఎంఎస్సి కంప్యూటర్స్ వాట్ ఎవర్ ఇట్ ఈస్, లైక్ వీ హ్యాడ్ టు గో త్రూ లాట్ ఆఫ్ స్ట్రెస్. యు ఆర్ ఆల్వేస్ కంపేర్డ్ టు సమ్వన్ అండ్ లుక్డ్ అప్ టు, లైక్, okay, look at him, look at this guy, because my parents have come from a situation where things were really bad in India. So for them the survival was the only only way. Okay, all that you have to do is get a job, get a salary, get married, that's all. Then you're settled. So instead of like, okay, నీ passion ఉందా లేకపోతే are you an artist, అది వాళ్ళ తప్పు పట్టనా కూడా లేదు. ఎందుకంటే దే హావ్ సీన్ వెరీ బ్యాడ్ ఇండియా వెన్ దే వర్ గ్రోయింగ్ అప్. Like emergency, India went through certain emergency things, and lot of bad stuff happened in north of India, and south of India also a lot of stuff happened. So, because it was India was a country which was growing. It was more into adolescence at that point of time. Now things are settled, but having said that, we people are like, how do we avoid putting our kids to the same scenario? Because this happens to me whenever I look at an Indian fifth grade book and a fifth grade syllabus in any other nation. I mean, for this matter, this nation or any other nation, basically international education. So when I compare them, I feel the Indian fifth grade book is more heavier or more stronger, and that eventually creeps into my mind to ensure that my child is also going through similar standard of should I call it stress. So how do I avoid that? Like, what are the ways I should think that I don't stress my kids, and does this stress impact kids also? That's another question.
So I already sort of mentioned about the parents' involvement. Whatever you do, spend some time with the kids, involve yourself, try to put yourself in their shoes all the time. Think from their angle of looking at the world, rather than just imposing your thoughts and your ideas of a good future or things like that. Then you will reduce the stress that you are causing to them from as a parent. That's very important. Fortunately, the structure in schooling is quite different from that of India and here. I mean, I have gone through the system and I've seen my children going to the schooling system. Up to the grade 7, మిడిల్ స్కూల్ స్టార్ట్ అయ్యే వరకు చాలా ఈజీగా ఉంటున్నారు. సడన్లీ ది గ్రాఫ్ గోస్ లైక్ దిస్. ఫ్రమ్ 6 to 7 నుంచి స్టార్ట్ అయ్యేలా పీక్ ప్రెషర్ అనమాట. గ్రేడ్ 7 నుంచి గ్రేడ్ 12 వరకు they bombard like anything. అక్కడే చాలా మంది స్క్రీన్ అయిపోతాం అనమాట. అట్ ది ఏజ్ ఆఫ్ గ్రేడ్ 12, many people, school dropouts, high school graduation is as if it's a university degree here. So after that, of course, some people, very few go to university. Many people go to college level and they pick up some job-oriented professional courses and then settle in those areas. University students, university numbers are very, very less.
Yes.
Hardly 10-15% of people go to the university. College, there are quite a few.
సో మీరు చెప్పేదాని ప్రకారం చూస్తే అలాంటప్పుడు పిల్లల్ని స్ట్రెస్ చేయడం తప్పు కాదేమో అనిపిస్తుంది మరి మీరు చెప్పేదాన్ని చూస్తే.
స్ట్రెస్ అంటే వాళ్ళ ఆటోమేటిక్గా స్కూల్లోనే ఆ స్ట్రెస్ స్టార్ట్ అయిపోతుంది.
ఓకే, ఆ సిలబస్ కి
గ్రేడ్ 12 లోపని వాళ్ళ ఎబిలిటీస్ బట్టి వాళ్ళు ముందుకు వెళ్ళిపోతుంటారు. దే వాంట్ స్టాప్. ఈవెన్ ఇఫ్ యూ టెల్ ఆర్ నాట్ టెల్, దే స్టిల్ హ్యావ్ దేర్. ఓన్లీ థింగ్ which we should be cautious about, with what kind of group they're making, what kind of preoccupations do they have?
Correct.
They are on the right track. Just encourage them. ఎప్పుడైనా కొంచెం డిబేట్ అయ్యి రాంగ్ గ్రూప్స్ లో పడుతుంది, తర్వాత సబ్స్టెన్స్ ఎడిక్షన్స్ ఇలాంటివి స్టార్ట్ అయిపోయి 7, 15, 14 they're exposed to
various things, and it's so hard for us to monitor 24/7. I understand. I totally understand what you're trying to say. All right. So, so we are towards the end of 1 hour session, which I've requested you. So, before we conclude, I really wanted to understand two things. One, a promise from you for another session whenever you are free. So it's free ఉన్నప్పుడు ఇంకోటి. And our session I want to delve into paranormal things which you have come across, if it's possible for you to share. And okay, that's session number 2. Now, final question for you is like, ఇప్పటిదాకా మీరు చెప్పిన చాలా ప్రాబ్లమ్స్ ఉన్నాయి. అన్ని ప్రాబ్లమ్స్ కి what is the is there a way, is there a solution? Because you did mention about solution for sure, but like what is the role of the divinity? What is the role of spirituality? What is the role of meditation in all the problem, solutions for the problems which you have mentioned? So do you think refuge in divinity will help?
Very good question. I passingly mentioned about prevention of the psychiatric disorders, improving the mental function can be done, reducing the stress, managing your life in a more organized way, certain disciplines, exclude from disciplines like those are some of them, and one is more inclined to the spiritual path. Yes, particularly meditation has got a very positive impact. It improves in many ways. It increases your ability to focus. It increases your memory. It increases your qualities like kindness. In a way, actually, it prevents some of the physical illnesses. Mindfulness, the transcendental meditation, for example, is one particular the meditation practice which is proven that it can treat diabetes and high blood pressure, things like that. For example, Sudarshana Kriya of Sri, they have studied it. They've proven that it is effective to prevent some of the physical illnesses as well. So you can list as many as you want the benefits of the meditation. There's a definite positive impact. Yes, it does prevent the anxiety. It does decrease the anxiety. It relieves the insomnia problem, and manages your mental health much better. So in whichever the form of presentation of your mental illness, many of the symptoms like anxiety, depression, insomnia, it improves your ability to control substance use.
Because you kind of get hold of yourself in this process.
Your self-control will be improved. So it has definitely a lot of positive. The only thing is whether a person who already has a serious mental disorder is in a position to pick up that practice and develop a discipline and make them stay focused for meditation is a question. But if at all it is achievable, it is good. So as a person who is spiritually inclined, I must say that all the adolescent children, if they're taught some form of meditative practice, there are a number of types of meditation.
Yes.
Whichever the one which suits your mind and your lifestyle, you can choose, and all of them have that positive benefit. And if they, from that age, if they develop that discipline, as they grow into their 20s, 30s, 40s, 50s, you are going to see much better functioning person, both from physical health point of view and mental health point of view.
Wonderful, sir. Wonderful. This has been such an enlightening discussion which I had with you today. Like చాలా విషయాలు తెలిసాయి and చాలా doubts clarify అయ్యాయి కూడా. Thank you so much for your presence today. And I really appreciate your time. I mean, busy schedule, you pull out time for me.
If any of this conversation is helpful for anybody, please feel free to tell people that they can call me directly if at all they have any specific questions. I will try to answer as best as I can.
That's so nice of you. Thank you so much, sir. And if at all your time permits, maybe we'll meet for some another session, and I want to dig deeper into
They have the specific areas of psychiatric disorders that you want to touch upon. That means we can have a session.
Yes, and I'll see how, and also seek questions from the people who watch the video. Amazing, sir. Thanks a lot. Thanks a lot for your time. I really appreciate your presence. Thanks a lot, sir.
Thank you.
Namaskar.
Bye.